Hi, thank you for watching. This is Dr. Todd Austin from Austin Family Chiropractic in Verdon, Illinois, and from ColdLaser Consulting. So I have not done a video in a while. Apologize for that. I've just been crazy busy with other stuff, with life, my kids, etc., etc. I hope to do some videos more frequently once again. The reason that I'm going to do this video today is just a good opportunity as far as to educate the public and other chiropractors on something, the way that I do it around here. The example is I have a longtime patient. She's been a patient of mine for 20 years, very loyal patient. She has been coming to me for cold laser therapy for ever since I started using the lasers 13 years ago. And so she's a huge fan of the lasers. She is a huge fan of the biomats as well. She's actually bought several biomats from me, and she is obviously a fan of the light force type of chiropractic that we do in her case, because she has some complicating factors, so we can't use a lot of force with her. She has been a very loyal patient. A month ago, she told me that her husband hurt his back. And he's always been a big skeptic of chiropractic. He's always been a big skeptic, never wanted to try chiropractic really, just kind of wanted to poo-poo it when she talked about it. So a month ago he hurts his back, and he's complaining to her, and of course every time I see her, which is every couple of weeks, she complains to me about it. Sometimes she even texts me or emails me and tells me about how much pain he's in, asking my opinion. Now, they live about an hour away from me, by the way. So what I told her is, I said, he needs to get in to see a chiropractor. I don't care if it's me or someone else, but he needs to get in to see a chiropractor. And yeah, I think the cold lasers would be helpful as well, obviously. Finally, she got him in to see a chiropractor in the town where they live, about an hour away. And he saw this chiropractor 4 times, was definitely making some progress, but a lot slower than he would have liked. So yesterday she contacted me kind of on an emergency basis. She had an appointment yesterday, was wondering, can I get my husband in? Can you laser him after you see me? So I basically told her I could do that. So he comes in, and we do a thorough exam, and he'd been having some sciatica issues. I've been going all the way down to his foot. The foot was totally numb, and he explains to me the previous chiropractor's diagnosis and what he had been doing, what types of therapies. Now this is a situation where essentially I could become what we call a patient stealer and steal this other chiropractor's patient, but that's not the way that I roll. When I really look at chiropractic in the profession, we have a lot of people out there that are cutthroat, but my whole thing is I try to get along with all the other chiropractors in my area, other than the one who has basically put the screws to me before. I trusted him and he betrayed me. I'll never work with that guy again, but the other, X amount of chiropractors in a 30-40 mile radius of my clinic, I enjoy working with them, I enjoy co-managing cases with them, and I enjoy impressing them with what I can do with the cold lasers when most of them do not have cold laser therapy in their practice. So instead of looking at these other chiropractors as competition and trying to steal their patients, I look at them all as potential referral sources. So anyway, this gentleman comes in, we do a thorough exam, essentially isolated the nerve root level where his impingement was coming from in the low back, just one area of tenderness right on a nerve root. First of all, I agreed with all the other stuff his chiropractor told him. I told him continue doing the exercises that he told you, which the patient showed me. They should definitely continue to be helpful. Seconded his recommendations for using ice or cryotherapy, seconded his diagnosis that it was not a ruptured disc or herniation, it was more of a chiropractic pinched nerve issue, subluxation. So basically agreed with that chiropractor, told the patient you need to continue to see Dr. So-and-so as he recommended. That would be my recommendations too. And I explained what we're going to do today with the lasers is simply going to assist that process, get you some pain relief quicker, because the way that it works in our office, since we've been doing the lasers, 80 to 85% of the time you will feel some improvement within 3 to 4 hours even of the first laser treatment, whether we adjusted you today or not. And so about a third of the time you'll actually be feeling better by the time you pay me at the end of the visit or getting ready to schedule your next appointment. The deal was with this fellow, he actually felt better by the time he left. His wife, who was sitting out of the waiting room, she was rather impressed because I did a very thorough exam and I lasered her husband, who was in a significant amount of pain and was really had been pretty cranky for about a month. And the fact that he was doing better already, and she could tell that, and he was smiling more. And then I followed up with them last night, and she said, yeah, he had a very good response to the treatment. Thank you so much. We really appreciate you getting him in and lasering him. So this is an opportunity for me. This is really a win-win-win all around. The patient's wife wins because he listened to her advice and it helped. The patient wins because now he got some quick relief. I win because now I get to potentially co-manage a case with another chiropractor who I had never heard of or met before. Chiropractic wins because we got 2 chiropractors now that are working together for the betterment of a patient instead of trying to butt heads and fight over a patient like I've seen so many chiropractors do. Potentially, I may have a chance to reach out to that chiropractor, let him know what I do, say if there's any other patients that have a tough case that's not responding as quick as you would have liked. I know we're a little ways away, but please feel free to reach out, and I'd be happy to do cold laser therapy on your patients to kind of get them over the hump if we need to, get them some quicker relief, if they'd be willing to drive the distance to see me. So that's how I handle that, looking from the abundance mindset that, I'm fairly busy. Yeah, I could stand to have a little busier practice, but I'm fairly busy. I'm busy enough that I don't need to go out and purposefully steal other doctors' patients. Just looking at it from an abundance mindset versus a scarcity mindset where the patient stealer doctor would be. So that's my takeaway on this one. So when chiropractors work together, it's really for the benefit of the patient, it's for the benefit of the other chiropractors, everyone wins. On my side business, Cold Laser Consulting, this is one of the lessons that I teach my doctors. I have had a few doctors hire me so far this summer from different states. So Dr. Mark, Dr. Tom, and Dr. Joe, thank you very much for the confidence you've placed in me as I teach you about cold laser therapy, get you up to speed, and help you to get your cold laser therapy practice going in your current chiropractic practice. But one of the lessons that I teach there is I actually have 7 other doctors in a 30-mile radius that do occasionally refer tough cases to me for cold laser therapy. I do not adjust their patients. I'm not going to bite the hand that feeds me. I'm always going to basically recommend the patients listen to the referring doctor's advice. I'm going to send them back to that doctor to get their adjustments, and what we are doing is going to assist in that process. So I got 7 other chiropractors that trust me to do that, and I'm always looking for more chiropractors to work with in that respect. I hope this is a good lesson for some of you younger doctors, even some of you older doctors out there. I hope it's a good lesson for just patients as well, that there's no reason that you can only have one person that has a D.C. behind their name on your healthcare team. So thank you for watching. Hopefully you'll subscribe to my channel and watch future videos. Until then, have a terrific day and let there be light.